How can the ideas explored in your new book on healing translate into tangible policies and improve health and longevity on a broader societal level?
So we live in an interesting time, as I said. When this book was coming out, we had no idea who was going to win. I wasn't really paying attention to like when the election day was. But we have a confluence of a lot of really interesting things happening at the same time. The conversation of healing and health and thinking outside of the walls of the hospital, thinking outside of, insurance companies, that is finally, coming at the forefront. Regardless of what your beliefs are, the fact that we're having these conversations and that people in power are having these conversations, I think is really powerful. I think all of us, if you're in this room, you likely play a big role in health and healing, either at work, or in your personal life. And so really taking those gifts that you have, advocating for better policy, and also advocating for your community, I think is really important. And I think the biggest thing, other than sort of the workplace element that I mentioned before, one of the biggest things that is missing in the wellness world that we absolutely, like, if I had like a magic wand that could sort of add this to every single wellness or longevity conversation that we have, we need to talk about the social determinants of health. So we cannot talk about whole foods and healthy food and plant-based eating and all of the stuff without talking about the fact that we live in a country and a world where food insecurity is a major issue. I went to public health school in Baltimore in the middle of a food desert. If I wanted to go to the grocery store during a break, I couldn't. I had to go to like a local convenience store and buy chips, right? And so you can imagine the families that had really little choice if they're working 3 or 4 jobs. So we need to be having that conversation, because the further we go, again, it's a $6.2 trillion industry. The further we dive into that, the further we're going to contribute to the inequities around us, where we're going to have more of a divide between the haves and the have-nots. And so every single conversation about wellness needs to be inclusive of the inequities that we have, and all of us need to play a role there from a policy point of view and an advocacy point of view as well.
I think that's